Hi, this is Dr. Castanet again, coming to you today with a lumbar MRI scan of a 21-year-old male with low back pain and sciatica. He had 2 injections in his low back that did not help a whole lot. He came to me mostly actually for paperwork, but hopefully I can help him as well. We'll see. If you can take note here, and it's nice to look at young MRI scans once in a while because you'll see things you don't see in older MRI scans. In this case, very bright signal here in these discs, indicating good, healthy, hydrated discs with no significant degeneration. And then, boom, look at this one, L5S1. Now this could be what was I going to say? This is L5S1. I was thinking he might have lumbarization of the sacrum, meaning this could be S1 and this could be S2, but I don't think that's the case on further reflection. So we have in the sagittal plane, very wide canal as you'd expect in a young person, no acquired stenosis, of course, and no congenital stenosis or narrowing. And we have a bit of a disc bulge and herniation. I should make the case here for you that this is not a good quality MRI scan. You can tell from the resolution it's not. This, unfortunately, as happens often, is a clinic that referred him to their own MRI machine. They're not, obviously, they don't have a great MRI machine. This is a pretty low power magnet, I think. The powers and resolution are expressed in Teslas. A 3 Tesla magnet is the strongest and best MRI image we have so far. You'll find those in hospitals, in MRI facilities that specialize in MRI. You'll often find 3 Tesla and oftentimes 1.5 or 1.0 Tesla. Those are acceptable. 1.5 is good. 1.0 is fine. Anything less than that really shouldn't be done. Anyway, this is poor resolution. The problem with that is that with poor resolution, if a neurosurgeon sees him, he's not going to want to base a surgical opinion on a compromised quality MRI scan. For my purposes, I still don't like it, and I think it reveals inappropriate priority in terms of getting patients to good scanners, whether they're yours or someone else's. If you can't afford a good scanner for referral, don't get a scanner. They're not supposed to be profit centers. They're supposed to provide good quality diagnostic images commensurate with competitors. So at least, 1.0. And this could be 1.0, but it strikes me more as like a 0.6. I've even seen some scanners out that are still 0.3 that are still in use. That's just not fair to patients. Having spent time with surgeons, I know they don't want a poor diagnostic quality MRI scan. Now, the radiologist who reads it is not going to complain about it. He's not going to bite the hand that feeds it, in my opinion. So he's not going to be, he'll make comment maybe about the quality of the MRI scan, but typically that has to do with motion artifact, not the strength of the magnet. If he does that, he's going to alienate whomever's paying him for reading the MRI scan. So he does the best with what he can. And it's for the doctors using it, in the clinical setting to decide where they're going to refer patients. I do not send people to scanners like this. And I let patients know this is not a good scanner. If you get a scan in the future, you want to pay attention to the power of the magnet. That's important. You don't just go out and get, let's say, for example, they're cash paying patients. You don't just go find the cheapest MRI scan you can find because some aren't worth the discount. You can get a good discounted MRI scan, probably $400 cash is the least I've seen for a good quality 1.5T magnet. And you can find them for $275, but that's probably going to be a crappy magnet. Anyway, you can see in the sagittal slice that this is not a bad herniated disc in this particular slice. This software was also very difficult for me to manipulate, so it was hard for me to see all the sagittal images. I tried to find the one that looked the worst, and this is it, I think. So I can't really tell. Obviously, it's not massive in the canal, But if I had better detail, I would be able to see better how far this is sticking out relative to where it ought to be. But I have concerns about this. It looks pretty large, and it's very degenerated at this level. This injury of his happened, let's see, 2 years ago now, and he's still struggling with pain. Let me go to the next image. This is essentially the same image. It might be a little bit different, but it looks pretty similar to the last image. Let's go back. This could be the same image. It was kind of hard to tell. Let's go to the next image. This is a cross-sectional image. This disc material should not be there, sticking out there. It should be pretty close to straight across from there to there. So this looks to me like it's sticking out a bit. This is the right S1 nerve root. This is the left S1 nerve root. I don't recall for sure right now if the sciatica was on the right side or the left side. I would guess left side based on the imaging, but sometimes images surprise you in terms of how they do or don't correlate with the symptoms. But I think he's got a significant lesion here, and it's a little bit unusual looking, which makes me concerned because I don't feel like the resolution is great in this image. Do take note of this. We've discussed the paraspinal muscles previously in patients. Young patients typically have very little fatty infiltration, such as we see here, and very dark muscle here in the paraspinal region. So he has good muscle. Now this young man is definitely overweight. He's like 5'10", 280. He is about 100 pounds overweight. He's probably got a 44-inch waist. That's all very bad news for a 21-year-old male. He's got to drop weight. I'll talk to him about that because in the long term, that's going to serve him for lots and lots of reasons. But look at all this subcutaneous fat. It's a great depth of fat. It probably should be right here, across about like that. And instead, it's way out here. So he's not going to be metabolically healthy for very long if he doesn't drop this weight. I did talk to him a little bit about that, and I'll elaborate more with him later and follow up with him. Let's go to the next image, another sagittal image. I think this slice is a little bit different. I feel like I could see this a little bit better. It's rather large, sticking out there, and who knows, even at 21, he might have to get a discectomy so he can return to work. He's been out of work now for quite a while. That's why he came to me, to keep him off work. He is tight on funds, so paying for treatment is difficult for him, in spite of the fact that I'm as inexpensive as you'll find in terms of treating people with, I think, the best treatment on a table that cost me $150,000. Any case, let's go to the next and last slice, the cross-sectional image again. And again, there's something odd looking about it, like this white area here, suggesting a possible tear, maybe there as well, some edema. Again, you see this herniation sticking out here. There's the right S1 nerve root, the left S1 nerve root. I think this is probably the one that was bothering him. Anyway, I'm Dr. Castanet. If I can help you with your neck and back pain and you're in Decatur, Georgia, the number is 404-558-4015. You can go to my website if you'd like to learn more, backstrong.net. I post a lot of videos like this on my vlog there. And also you can go to the YouTube channel where you can see the same videos as well. Thanks very much. Bye-bye.